The New Orleans Health Department has a new campaign to help lower the high number of sexually transmitted infections in the area.
And this is aimed at educating both doctors and patients about a simple tool that's known to lower the risk. Meg Ferris explains how it works.
For quite a while, Louisiana has struggled with high rates of sexually transmitted infections, often with some infections in the top number in the U.S.
And we've been seeing those numbers go up over the last few years. And New Orleans is particularly hard hit. So the city is, I think, appropriately taking this very seriously.
So ahead of upcoming big holiday celebrations and festivals, the city's starting a public information campaign to let people and the medical community know about a simple way to fight the problem.
Today, we're really talking about bacterial infections that are transmitted via sexual activity. So these include syphilis, gonorrhea, and chlamydia. And those in particular, New Orleans really has seen high rates of. Last year alone, there were 6,000 new infections, bacterial STI infections in our city. That's 2 for every 100 people.
A well-known and inexpensive antibiotic pill, Doxy-Cycline, is known to be safe and well-tolerated, and it's been used to treat everything from acne to malaria. It can be kept in your medicine cabinet to take if you are exposed to an STI from bacteria, not those from viruses like HIV.
And what we've found is that just taking 1 dose within 72 hours after sexual activity really dramatically reduces the chances of acquiring gonorrhea, chlamydia, and syphilis.
So what we want of people to know is that they can ask their primary care doctor about this. Since you need a prescription for it, you have to have that conversation with your doctor.
The program is called Doxy-PEP and has been shown in San Francisco to drop rates of STIs. Some people are going to be asymptomatic and they spread it unknowingly.
Yeah.
And so, and there are lower rates of people just going and have regular checks to even know they have it.
I routinely diagnose folks who have no idea, have no symptoms, and I am just doing it to screen them.
So have a conversation with your doctor. It doesn't have to be a specialist. You can go to a city health clinic or Crescent Care or your private doctor. And keep a prescription ready to fill or a bottle ready to open in your medicine cabinet if you think you may be at high risk. Meg Ferris, WWL, Louisiana.
To learn more about Doxy-PEP and to start a conversation with your doctor, we do have a link with this story on WWLTV.com.